Okay, great. Hi, everyone. Good day for wherever part of the world you're listening to me from. My name is Izine Aso, and I'm the host of the HSB podcast series where we talk about what it means to win in doing any healthcare business across the world, like any healthcare business, the pharma, and we have different series. We have the local leadership series, we have the market and startup spotlight series, and we have the systems series. Today we have a very special guest, who is very, for me, is when I came across his profile, I was so inspired. I was like, who is this person who is doing a lot in, in changing healthcare in this market? And I am so honored to have the privilege to have him on the guest. I was telling somebody that I don't know any other person in the whole of Tanzania who is better than, our guest today, because he has done a lot in like creating an ecosystem for healthcare creators, healthcare innovators, policy makers who are doing healthcare businesses in Tanzania. And today I'm privileged to have him on the podcast to share with us some of the things we might not know about the market in Tanzania, how we can support the market in Tanzania. And basically, he's also an innovator in the space who has been doing this for a couple of years. So, Mr. Anodi, it's really a privilege to meet you, and I would like you to quickly introduce yourself to us and tell us about you and what you're doing.
Thank you so much, Izine, and I'm really honored to engage in this conversation. When you first approached me about this podcast, I was also very excited to share what basically we are doing in Tanzania and how a healthcare system in Tanzania look like. And as I've been introduced, my name's Anodi Kaihula, social entrepreneur and public health. So I work at the middle of public health and entrepreneurship. I am the co-founder and CEO of Ubuntu Afya Inc., which is a youth-led social enterprise working to innovate and to bring the efficiency and improve the access to healthcare in Tanzania. And on the other side, I'm also the general manager at Tanzania Summit, which is the largest public-private platform, bringing stakeholders to forge innovation and partnership across the ecosystem in Tanzania, but also in East Africa. And on that, I previously also co-founded the Afya Lead company. So you can hear about Afya. Afya is a Swahili word that means health. So I've been working in health sector, and I'm really passionate about bringing a solution that works in the community and really solve the challenges that matter. Thank you, Ezin. Ezin, you are muted.
Oh yeah, thank you so much. I was exclaiming like, wow, wow, wow. Like I don't know any better person who could have been, who I'll be having this conversation than you, because like everybody has heard, you are somebody who has built the ecosystem. You are somebody who is innovating in the ecosystem, and you are somebody who has, you're somebody who has also like seen the systemic challenges, right? And you are a healthcare professional. So guys, you can see that there is no better person to have this conversation with than, Anodi today. You've built a number of healthcare businesses. You've done a lot in the healthcare space, not just in Tanzania, but in East Africa, like you said. I am curious to know, like, why did you choose to build for health? Like, what inspired you to build for health?
So first, it's my personal lived experience. I was born in Nyamiaga village. It's northern west part of Tanzania in Kagera region. And as many other African villages, my mother struggled to give birth of me. She was traveling almost 100 kilometers away, and alongside the way, escorted by my grandmother. She delivered me alongside the way in the middle of the way. So that story from my grandmother really changed me perspective and inspired me. If I go into health sector, maybe I can change something, not just for my country, but for my mother, Africa. And as my grandmother was a traditional birth attendant, and I remember she has delivered a lot of babies in my village. She really inspired me that I can do something in the health sector. Growing up, I was really very passionate. I go into health sector or I go into politics. I realized that politics was not just a career to major into, but could come maybe later on. Growing up, I pursued a Bachelor of Science in Nursing. So I'm a professional nurse, and I've attended several patients during clinical practices. But working into alongside the bedside, I found it was not just enough because most of the challenge now were much more systemic. If you do not have maybe a certain drug, that could be a systemic challenge that needs to be tackled from the policy level and sometimes to innovation and entrepreneurship level. So that's why I went to a Tanzania Summit where we mostly deal with police, and we advocate for better policy change. We create platform for sharing best practices and so and so. But also when you speak in terms of policy, you really need the doers. You need the innovators on board. That's why I've been focusing into building solutions, shipping them to the people. And those solutions are from the lived experience that I have experienced. I personally during the practices, from my colleagues and from the communities that I have been serving. But also the other solutions comes from the police perspective. What is the real challenge and what is the solution that can really matter at a time, especially in the health sector, specifically maybe in Tanzania or across Africa.
Wow. Wow, I love your why. Your why is just, I feel like everybody has a why. Everybody who I've met have a why for innovating in healthcare, but your why is just wild. Like you said, you wanted to do politics and healthcare, but somehow you've been able to do both right now. Like because your health summit is like a thing that you bring a lot of policymakers, just not just in Tanzania, but all over East Africa to like actually sit with innovators. So great job, great job. What you've done is amazing. I'm so impressed. When I told you, when I saw your profile, I was like, wow, who's this person? Like he's done so much, and I'm also like very curious to learn. I would like for you to tell us about Afya Link, Afya, Ubuntu Afya Link. Ubuntu means
Actually,
everybody knows. Ubuntu means I am because so basically you are a very altruistic. You are doing something that's very altruistic and beneficial to the people. So can you tell us what inspired the creation of Ubuntu Afya Link?
so as you have said, Ubuntu means I am because we are. It's kind of
Yes, I am because
African philosophy that it's not just about me, but it's about others also. And if others are good, then I'm also good. And if I'm good, then others must be good as well. So it's about that philosophy that I confidently believe in. That is the philosophy that I believe the world should live in. If you are good, then others must be good. And if others are good, then you will be good as well. And when it comes to Afya, Afya it's health. It means health. It's a Swahili word that means health. And when we were conceptualizing even yesterday for what should we call this something, we had identified the solutions, what we need to do, and now how should we name this venture? I remember I and my colleagues, Albert Mageuzi, Albert and the leader, we had a very big debate, just asking ourselves what should we call. When we combined those, we came out with that in a sense that we need to create solutions, not just solutions that will make profit, but that will make impact and change the lives of the people and save the people, not just about the profit. That was the number one idea. But the second, we need to make profit for us to sustain our impact. That's what is very important as well. Looking at the fast changing funding, donor funding, how most of programs collapse after donor funding, then that we are very much cautious that we need to create solutions that will generate profit, but profit for sustaining the impact that we want to do. So with the Ubuntu Afya Link, we are working into three solutions. One, I tell you the fun fact that some of the studies show that more than 40% of the medical devices in healthcare systems are not working in a sense that are not well maintained are not well, the facilities are not well equipped to maintain and sustain those sometimes very expensive medical devices. So we created the first solution, that is Ubuntu Medifix. So we help facilities to maintain their biomedical equipment, but also we create the system for them to manage their biomedical equipment and call to book for preventive maintenance and corrective maintenance when there is any breakdown. And we make that at much more cheaper price compared if they could have hired biomedical technicians, which are already very few in terms of the number. And or hiring big firms which might be very. So we use biomedical technicians and engineers. We train them to make sure they can be able to deliver and to help healthcare facilities. On the other side, one of the challenge is most of the facilities do not have reliable power supply. And for us, power supply is not just about energy poverty. I remember working in one of the facilities, which I won't mention today. It was one of the very rural facility I visited. I was doing one of the research projects, and when I visited, I had to engage into clinical activities. I remember one night when the power went um, out and we had no alternative. We had to use our phone touches. The fact that some of the facilities are off-grid completely. Some of those who are on grid, the power supply is not constant. So when there's a blackout, then they face the challenge how they can deliver the services, especially in maternity ward and most sensitive areas like ICU. So what we are creating is a green energy solution for these facilities. One, we help them to cut the cost in terms of operating cost, because most of these rely on diesel generators, which are a bit expensive. But the other interesting part, you may ask, what's special with your solar system? Because there are a lot of solar system suppliers. But for us, we are much more focusing on improving energy efficiency, but also cutting energy cost. So we embed these with energy efficient appliances like vaccine freezers and red medical lights, which really helps the facilities to cut their energy costs that they. We also unlock another angle, that is financing. Most of these primary healthcare facilities cannot afford upfront costs for even the solar system itself, leave alone automatic generators. So what we are doing is we finance them and they pay on installment, pay as you save life model. So you just pay slowly until you complete your system. And then in some cases, if they do not and they have high energy expenditure, we just install the system and then they pay depending on what they have used, while cutting their. In that sense, our mission is looking on how best we can create climate resilient primary healthcare facilities. Our main target is for primary healthcare facilities, because there is where over 85% of Tanzanians get services. And not just in Tanzania, but across almost Africa, it's where most of the people get services. So if there is poverty, energy, or inefficiency at that level, then there's a problem. And lastly, our third solution is on Afya booking. So with Afya booking, we help facilities to manage their booking. One, create convenience for patients, because no need to stay on the queue for 3 hours. You just book and doctor knows how many patients need support. But also for the facilities, increase the inflow of clients in their facilities. But also within the system we enable the facility to collect, to analyze with our integrated AI system, to analyze the client's feedback, because when you deliver the care, then you need to get the feedback from your clients, so that you can know where are you doing well and how best you can improve your service. So we help them to collect, to analyze, and recommend how best they can improve their quality of healthcare services, because it's not just about the access, but it's about the quality of service when which a client gets when you get into the healthcare facility. Yeah, that's
Oh
what
my
we do.
God. Oh my God, I'm so impressed. Like literally, I am just like looking at you as I'm just like I'm like, how do you do all of these things? Like like just even the telemedicine platform alone, it's a lot of work, right? I know that it's not gonna be very easy to build something like that. And boy, you have these, you have the green energy, you have the the my God, like I must commend you. You're a superhuman. You're a superhuman, definitely. And I'm so grateful that we have people like you who are building for health, who are actually like very passionate about solving real problems, because everything you've mentioned is actually real problem. Talking about the medicines, talking about the the patient care, talking about the access to energy. Because I feel like why I found you very fascinating is because a lot of times healthcare professionals, we don't look at the infrastructure, but what you have done with all of your companies is looking at the infrastructures, right? The healthcare, fixing of the medical equipment, fixing of the electrical access to power, which is very important to deliver medical care. So I am so impressed. I need to tell the world about you. I need to tell more people about what you're doing. I need to even come and collaborate with you, because this is actually very, very impressive. And I really thank you for sharing with us. I think you've answered my next question about the gaps that motivated you to do this work. But I'm just, maybe you can just share with us, like, how do you find time? How do you balance, building three companies at the same time? The passion.
It's it's one company, but with these three solutions,
Branches.
like this every solution, they actually depend into one another. We
Okay.
deliver all these solutions customized depending on the nature of the facility and what best works for them. One size fits all approach. So we design this depending
Yeah.
on the we customize this depending on the. But what's very important is about the people and the team that I have.
Yeah.
We always say if you want to go faster, you just go alone. But if you want to go
Yeah.
far, you just
Go with
go
the
go
team.
together. So the brilliant team that we have at the Ubuntu Afya Link, the people that we work with and who trust us. We recently won energy efficiency innovation challenge with UNDP. So these are some of the players that are trusting us, recognizing us, and giving us more energy to continue doing what we are doing. So it's not just a matter about Kaihula alone. It's about the team that we have behind, the
That's
partners
very
that we have around. It's about the support that we get from different players in the ecosystem.
Honestly, that is very important. I think that that's something that a lot of builders kind of like. Last person we had a podcast on the market starting from Namibia also said something about the team. So it's very, very important that we have the right team to build and support us when we are going against the world, view, and chasing after something that nobody has done. Because what you've done is really commendable, and I'm so impressed. And I definitely need to have this conversation after this podcast. But yeah, can we maybe just move to the next one and talking about the Tanzania landscape, right? I am very curious. I've never been to Tanzania, but I've heard a lot of great things. I've Googled and I've seen a couple of things. Some of us will go online, use ChatGPT and ask, but nobody knows better than somebody who is actually in the market. And that's why we have this market and startup spotlight series. Cool. How would you describe the healthcare landscape in Namibia? I'm sorry, in Tanzania. In Tanzania, in terms of like healthcare assets, innovation, the policy landscape, and all.
Thank you so much, Zine. Basically, in just a few sentences, when you ask me to describe about healthcare landscape in Tanzania, might be very tricky because there are lots to unfold. But just in summary, it's one of the fast growing sector. And at least for the past, I can say 10 years, we have witnessed the very massive investment in terms of from the commitment of the government investing into a lot of infrastructures, building the best hospitals, even at some of the village level, building emergency departments almost across all district hospitals, establishing, and that actually has translated into some of the good results. And one of the indicator was reduction of maternal mortalities by 80% for the past 5 years, as per Tanzanian Demographic Survey of 2022. That is just one of the indicators. But when you look at the uh,
Yeah.
healthcare facility, because we have built a lot of them,
Yeah.
but the challenge might be on what the patient, what the common mwananchi, mwananchi is the Swahili word that means local citizen.
Oh,
So,
okay. I've learned one.
thank you. So now the question is on what the common mwananchi get when goes to the healthcare facility. So the question is about the efficiency. The question is about the trust. The question is about the quality of healthcare when someone goes into the healthcare facility. But another important question is about the affordability of those healthcare services from those facilities. That brings a lot of questions and issues to unlock, but also that creates a lot of untapped potential that players, investors need now to try to see and to tap in into those kind of
Yes.
the opportunities that we have. Just to give you an example that the shocking fact is only 15% of the population is covered by health insurance. So
You better than Nigeria.
just that,
Okay.
just that alone. So you may have the very beautiful facility, but people can't afford because they have to sell their piece of land just to access the healthcare facility, the healthcare services that very beautiful healthcare facility. That is just example of untapped potential, but there are a lot of untapped potential. This untapped potential, not just the government can solve them. It needs each player in the ecosystem just to play the role and tap in, utilizing the current potential. It needs the innovators like Ubuntu Afya coming in and just giving contribution that will be sustainable. It needs philanthropists. It needs even the local wananchi themselves. They have the role to play to make sure that we really improve the quality of healthcare services. Despite the growth that we have achieved, and from some of those indicators that I've highlighted, still there are a lot of issues to unpack, especially in the area of the quality that can be delivered. How is it delivered as well? Like I've told you, someone can go to the facility and spend maybe 3 hours looking maybe for specialized services, which are always on booking. So that alone, staying into the facility for 3 hours, 4 hours, it's already compromising the quality that maybe a person expected when it goes to the healthcare facility. But on the other angle is, are these healthcare managers, facility managers, learning profitably? Because one of the other challenge in health sector is you need to balance between the two things. One being on just health as a human good, the public good, that you
Service,
need
yeah.
to deliver the quality despite of uh, the,
The profits.
despite of the income of the
Yeah.
person that you are saving. It's about life. But on the other side, you need to balance the profit, because if you
So
don't
true.
create profit, then you will phase out because you cannot
Yeah.
sustain what you are doing. And that is a very important trick part. And what we are doing, if you look carefully at our solutions, is to make sure that these healthcare facilities can run sustainably in terms of climate resilience, in terms of the profitability,
Yes.
and in terms of the quality that they deliver. Because when you have well functioning and long lasting medical equipment running and maintained at much cheaper cost, but also if you have good management of your booking, collecting and analyzing the feedbacks from your clients, you improve the quality of healthcare, and more you build more trust from the community and from
Yes.
the clients that you serve. But also on the other side is if you have, um, if you cut your operating cost, especially in terms of energy cost, you will run, you will increase your profit margins at the end of the day. And that's how you can best deliver the best quality and improve your services.
Oh my God, you're talking from experience, because everything you are saying is just resonating with me and all I've learned in the course of my MBA program at Johns Hopkins. There's a very I feel that's where a lot of healthcare business struggle. You struggle between the social good and actually making profit for your business, because most times people feel like because healthcare is human lives, healthcare is people who need to be alive. They don't understand that every business is a business, and that's why the HSB podcast is
Yes.
like that's our vision. To leaders understand that this is actually a business. As much as you're balancing profitability and balancing like trying to like make sure that people have health, you actually have to be profitable to be sustainable and to also be able to deliver quality care, not just care, because really, like they say, there is no price to a human life. There's actually no price to a human life. So I really thank you for calling those out, and how everybody has a part to play, whether you are a Tanzanian citizen or you're not, or you're an investor. I believe so, right? Everybody has the opportunity to come to Tanzania to invest,
Yes, exactly.
right?
And the more the health sector become profitable, the more we drive more
Yeah,
investments, and the more we will
awesome.
actually ensure the quality of healthcare services is improved.
Welcome to invest. It's a business, right? As much as we want to do social good, we have to think about the business side and making sure that the care is delivered. Even though we are trying to like bring down the cost, affordability is a big gap. Nobody's denying that fact. But at the same time, we have the opportunity to come up with innovative funding, financing models that patients can be able to access care, better as a result of our innovation. That is what our founder Anodi has done in this past years. And you can work with him, you can partner with him, invest with his company, and help him amplify what he's doing, not just in Tanzania, to other parts of Africa. So yeah, I'm so curious to know, like I'm so impressed, like the way you've infused, energy into healthcare, and that is a very different model that, a lot of people have not really explored, right? In terms of like how do you infuse both. So I'm curious to know, like, what are those challenges you face so far in terms of like, your business, like particularly the one with the energy, right? I don't know, maybe you can talk in the context of Tanzania, or you can just speak broadly, right? What are those challenges that, have as a healthcare innovator you faced? Yes.
One of the challenges, especially when you are innovating innovation that involves financing, one of the first barrier that we need to experience is in terms of funding, because now you need enough capital for you to invest in, because the return are not just immediate. If I supply the solar system to healthcare facility, that will expect to pay me within maybe 2 years. Despite that, I have put a certain margin in to make sure that I get the profit and like retain the value for money. But the challenge is you need the capital for you to continue running while waiting for those 2 years to get your money back completely. So I think financing and access to financing it's still the major challenge, not just for us as Ubuntu Afya, but for many other innovators who are working into financing and so fintech related solution. But the other challenge is on the essence of uh, climate resilience healthcare system and the facilities that we really want to create. So now what we are doing, we are creating the model for climate resilient healthcare facility. But when you have the well functioning equipment, that means you can tackle any healthcare climate induced crisis that may happen at your community level. But when you have energy efficient system, right, the Afya solar solution that we are deploying, then you will be able to cut your cost, but also to make sure that you have reliable and constant power supply. So the challenge is, how do you explain that to a mere, just to the local mwananchi who is maybe owning the healthcare facility,
Yeah.
just to get clearly the concept. But what we are trying is to make sure that we communicate in a way, in a language that they really understand. And especially for these healthcare managers want to see how it translates in terms of profit. How is it translating in terms of cost cutting? Those are the key areas that they are struggling with. How do they cut their operating costs, and how do they maximize their profitability? So when you speak those two languages, most of the time, I've seen they pick up, but that remains to be one of the major challenges. But the most important challenge is in terms of financing, because most of the healthcare investment might not get you might not be able to get uh, the returns immediate. Most of the returns need to wait for some time, and so most of the investors who look on very quick returns then might be starting to make commit huge investment in that sense.
Wow, wow, wow. So everyone who's listening to this, see how you can be a partner with Anodi, because I personally I believe in what he's doing. It's a needed solution. It's a solution that, everybody needs to live, right? Power is very important in a healthcare facility in Africa. We need to actually see what it is like, right? Not just in Tanzania, what the power outflow is, right, for healthcare delivery in all of the continent. But please reach out to him. He's somebody I believe in personally. I know that what he's doing is needed, and you need to support him, like support people like Anodi, who's doing great work already in this space. So but I personally am going to reach out to him and just have a conversation on how I can support what he's building, because I believe in what he's building, and it's very important for patient lives, not just in low resource income settings that power is still a challenge. So thank you, Anodi, for sharing this is very exciting. I've learned so much about you. So as a founder, like what's that one thing you wish you knew before you started, right? And what has surprised you the most about building in healthcare? Because I know that it's not easy building. So what is that one thing you wish you knew, right, before you started this journey?
There are a lot, of course.
What's the outstanding or two? You can just say one or two.
I never imagined that one day I would be working into energy and like requiring to understand, basically the basic concepts of how energy it works and so. But all this is that understanding that maybe power is the fundamental infrastructure, because you cannot talk of digital health if you do not have power. That is the fact, and most of any other indicator that we need, then power is very important element. But one of the things that I wish that I would have known earlier is just about the power of the team. Just me assembling the brilliant
Yeah.
talents
Yes.
was very important. Was a very important step, and I think I was able to do this because I was carried the experience of way back building at the Afya, which now continues to be one of the fast growing startups again in the Tanzania ecosystem, delivering maternal health solution to the primary health care and to the last mile. But the power of the team and how to attract brilliant talents, how to motivate them, and how to make them just build something that will really create the impact. I think that is one of the things that I wish if I could have known this for the past 5 years, probably we would be speaking different story. But that is one of the best and interesting.
That is that is actually very important, because as you're talking, I could talk about my own personal experiences that team building is actually one of the most foundational thing for any founder, right? Because a lot of startups get shut down because of the wrong founding team, the wrong team members, having the right people talent to work on your So it's really valid, and I wish you the best of luck, in this journey as you constantly attract. We will need to talk. I would personally like, love to engage you on some of these lessons because I am also someone who is passionate about building too, and I like to learn from people like you on your journey. So thank you. This has been a very insightful session. I have learned so much about what you're doing, and also Afya Health, Afya, Ubuntu Afya, all of your companies, Tanzania Health. So I hope one day, please, when is the next summit? I hope to maybe plan my time to see if I can, fly into Tanzania for the health summit. And
Sure. We always have our summit in the first week of October. So our next summit will be, yes, on 7th to 9th of October 2026 in Dar es Salaam. So you are warmly
wow, would that
welcome
be
to
next
enjoy
year?
the
Would that be
beautiful
next
Dar
year?
es Salaam, the beautiful Tanzania.
Nice. I would love to. Definitely would love to come. I would maybe reach out to you. We'll talk more about that because I think that would be an opportunity to do a vacation and also like get to meet
Yeah.
healthcare leaders and also like have a experience of your organization you're building. Thank you so much. I would like to end. We always end the podcast with a quote that keeps you grounded. What is that favorite quote of yours that whenever you feel like giving up or say, I'm tired of this? What is that quote that keeps you grounded as a builder in healthcare?
I think that quote would be to one of my mentor and the person that always has been inspiring me alongside throughout my career journey, Dr. Antuli, who said, "Be my hero in building, in saving the mothers and newborns." So just being a hero into saving the lives of mothers and the newborns. So always that resonates with me and it keeps me grounded into the field. And everything that I design, I make sure that I remember how does this save mothers? How does this save newborns?
That is actually it's very actually something that can put you on your feet and give you chills. Be my hero in saving the lives of mothers and newborns all over the world. That is a big, ambitious, quote that can keep you on the ground and make you wake up every day. Because sometimes personally I feel lazy, but when I think about my own journey and I'm like patients in back home or patients globally who need our help, that keeps me motivated. So thank you so much for sharing. This has been a very insightful conversation. We've learned so much about the market in Tanzania. We've learned so much about what it means to build for healthcare, its lessons, team building being very important. We've also learned so much about the market in Tanzania, and if you're ever going to be in Tanzania next year, make sure that you attend the Tanzania Health Summit because
Yes,
that's where you get to meet more people who are building. And we have Anodi, who is like the leader in that space, as in the healthcare startup space in Tanzania, sharing his journey with us. Anodi, I want to say a big thank you to you for being on this podcast today. We've learned from you. I personally have learned from you, and even if it's just an audience of one, that's enough for me. If I'm the only one who will learn, but no, there are gonna be a lot of people who get to listen to this and
I
learn
also
from your
thank
journey.
and I also thank our listeners because
Yeah,
this conversation wouldn't have made sense if they don't listen.
absolutely. Yes. So definitely, I thank the listeners, everyone who's going to come across this to learn from, our great innovator here, Anodi. Please reach out to him. How can people reach out to you, Anodi, if they want to?
I'm just available on my LinkedIn.
Okay.
If you search Anodi Kaihula, then you get me on Instagram, Facebook, whatever. If you DM me, then I will be happy to connect and to respond and to collaborate.
Awesome. So thank you everyone. This is the HSB podcast series where healthcare means serious business. And like Anodi has said, we need to balance healthcare profitability and the social good, and that is why we have these conversations to spotlight some of the founders who are building great, and also markets that you can invest in as an investor. So please, let's keep tuned, follow us on our media page, and watch out for the audio, I mean for the full video podcast on all our platforms. Yeah, so I think we have had a great conversation today, and thank you to everyone and have a great time. Bye. Awesome.
Right. Thank you.